The Canadian Medical Association is raising the alarm about staffing and wait times in emergency rooms right across the country. CTV National's Scott Hurst is following this story for us this morning. Scott, good morning. So a new call by the Canadian Medical Association to address our overwhelmed healthcare system. What are they saying?
Good morning, Jen. It's well documented, the crisis in Canadian healthcare, from long wait times to staffing issues. But you don't have to be following the news day to day to know that this is a significant problem. You just have to try to book an appointment with a primary care provider or show up at an ER and see the significant wait times, which is why the Canadian Medical Association is out with a new plea, a new year, new urgency to the crisis, calling on provinces and territories to prioritize signing and implementing healthcare action plans to increase access and improve working conditions, modernize the healthcare system, Jen, with one specific call to improving access to primary care, as this causes a domino effect with many people showing up in the emergency room and putting more pressure on an already overburdened system.
Okay, Scott, and what are we hearing from provinces while hospitals remain under this strain as the respiratory illness season near its peak?
It's a similar call and a sad story from province to province, coast to coast, that there are long wait times and staffing issues where patients, when they are seen, often end up being treated in hallways. In Quebec, emergency departments are at 137% capacity. In BC, they're talking about a double whammy tied to population boom and respiratory illnesses, that they're seeing more patients in hospital than at any other time in provincial history. Here in Ontario, the union representing Ontario hospital workers this week put out a survey saying about 2 in 5 have thought about quitting, and a similar number of people dread going to work every day. So the CMA is out with this new call, the same old issues, but a new call to action, Jen.
Certainly a troubling situation in our healthcare system. CTV National's Scott Hurst, thank you for that.